A new nursing academy is being set up to increase the number of qualified nurses and healthcare workers in Aotearoa and to help address the current workforce issues in the sector. Healthcare Academy New Zealand's new facility will be based in Tāmaki Makaurau and expects to train hundreds of enrolled nurses each year with capacity to train up to 1,000 healthcare workers across various fields. Aotearoa, CEO of Healthcare Academy of New Zealand, says the Academy's doors are ready to open to help support the critically understaffed healthcare workforce, and she's with us now. Tēnā koe, Ana. Thank you for joining us.
Kia ora, Neil.
Well, give us an idea of the focus of your academy and where did the idea come from initially?
Well, the focus really is just building a stronger homegrown workforce in New Zealand that meets sort of the skills shortages we know we've got in the healthcare sector. And the idea really came through a lot of conversations with industry. Within our group, our wider up education group, we've got colleges that already deliver some health qualifications. So we talk to industry a lot and the Tertiary Education Commission. And through conversations, we knew that nursing in particular is where there's some severe shortages. And this qualification we're looking at, enrolled nursing, is quite unique in that it's an 18-month qualification, so it's not necessarily a bachelor. And the conversations with industry, particularly in the healthcare, in the aged care sector and mental health and addictions, was that enrolled nurses could play quite a significant role to help alleviate sort of short-term shortages that they've got. So that's kind of where it all came to be.
But you don't offer, as you mentioned, a Bachelor of Nursing. Is this set to change at any time? And what qualifications will the Academy be offering?
Look, we always wanted to focus on enrolled nursing because what I said, it being an 18-month qualification, it can eventually pathway into a bachelor, and we would be very open to doing a bachelor. But there's a lot of providers that do that. So our focus really was enrolled nursing. In the future, we're looking at allied health, which is another sort of big focus area, aged care, health sciences. So the Academy can cater to any area where there's severe shortages. We would like it to be enrolled nursing because we know nursing is where we have the highest shortages in healthcare in New Zealand.
Give us an idea of how the Academy will be encouraging and supporting more Māori and Pasifika nurses and healthcare workers in their training.
I think it all boils down to, the outcomes we have are exceptional for these learners. And it boils down to we've got a really holistic approach. It's very student-centered. It involves the whānau. We get to know what a student's sort of life outside of college looks like. A lot of them have family commitments and they're trying to juggle helping out at home and studying and getting to the clinical placements. So I think the fact that we've got this smaller class size, a lot of learner support, really holistic care is how we get the outcomes that we get. It's kind of the secret sauce. And this is what we would apply to the Healthcare Academy, just high care factor and really involving the broader community that students are part of as they're learning. It's not just one student who goes through the journey, it's a whole family actually when they enroll with us. So yeah, I think I would say that that's what makes us quite unique.
Yep. What does it cost to be part of the Academy and do you offer scholarships?
Look, the cost is exactly as it would be in any other, in Te Pukenga or any other provider. So we're partly funded by the government. A student takes a student loan. It's about $10,000, just over. I think where students and healthcare generally struggles, and we need to solve this, is the clinical placements. It's a lot of hours, and students have to commute to a clinical placement. Sometimes the commute is on the other end of town, so it's even hard just getting there. They're not getting paid. So somehow we do need to work with our key regulators to see how we solve this conundrum, because we're not making it easy for students. It's a hard journey to study in the first place.
Sure.
On top of that, they're doing 750, 900 clinical placement hours, and they're having to fund that themselves. So that's quite tough.
Yeah. I love the thinking. Aotearoa, CEO of Healthcare Academy of New Zealand. Thank you so much for joining us today. Let's catch up again when your academy is into the teaching phase, just to see how things are going. Ngā mihi.
We'd love to have you. Thank you.